It's a nonprofit out of Dallas. It's through a church. They've been working in Haiti for at least about the last 10 years. To me, it was more about instilling a sense of hope that something can really be accomplished by what we're doing. And so basically all we did was go down and talk to different families, different community leaders to figure out what are some of the problems here.
I really felt inspired by the work we were doing, and I could see that I was making a difference here and helping this organization go on to do a lot of good.
Helping the pastor Francois build a school to help him raise funds for his clinic, as well as to start a sponsorship program.
At first it was a little overwhelming from everything you see, in the sense that there's so many problems. You don't really know where to start. You don't know where to hone in on, because there's health, their economy is in bad shape. There's education and school problems, just people walking down the mountain 3 times a day just to get water.
It was just really powerful to think about these 7- and 8-year-old kids doing this 4 times a day. We can bring water to this community. Like, these kids will have more time for school, more time to be kids, just simple as that.
We did have an afternoon where we met with the youth of the community, and that was, I think, one of the more challenging days for us. What really came out was this sense of hopelessness from these students. They're very bright minds. Those who are lucky enough to go to school are working hard to get through school, but they don't see any real future once they can finish that education. So it's a really tough challenge for them, and they can see the reality of that. And they just have this sense of what is the use in doing all this, which is heartbreaking.
The biggest focus that we were looking at is the hospital we need to help them complete. On the emergency side, try and get an ambulance into the area, because right now, not only do they not have a hospital, but if they want to go somewhere to get care, they don't really have a vehicle to make that trip.
When we visited the clinic, we met the nurse and she showed us around, and then they have the delivery room, and there's the bed with the stirrups and the baby scale, and this is obviously where she delivers babies. And we asked her kind of what do you need here? What would make your job easier? And she said, electricity make it so much easier. And we're like, oh, well, that seems like an obvious thing. But she said, when I'm delivering a baby at night and you can't schedule those things, there's no light and I can't see what I'm doing. We can't see if the baby's coming, so I have to deliver the baby sometimes with my cell phone in my mouth. I went back to her before I left and I gave her my headlamp and a bag full of batteries, and I was like, no more delivering babies with your cell phone in your mouth. I mean, she couldn't talk to the mother and talk her through it. She had to hold the light so she could see what she was doing. And now at least she has a little bit of light to do that. But to have a hospital nearby, they can deliver babies. That's going to be a huge, huge thing.
So, okay, do me a favor. Point at yourself.
Tout le monde, montez des doigts.
Point at yourself. Now you repeat after me. All right. I am.
Moi c'est.
Moi c'est.
Somebody.
Moi c'est un monde.
I am.
Moi c'est un monde.
Moi c'est un monde.
Special.
Moi c'est un monde qui est spécial.
I am.
Moi c'est un monde.
Moi c'est un monde.
Wonderfully.
Moi c'est un monde qui est merveilleux.
Made.
Fait.
Mostly I was thinking, this would be a great opportunity to give back and use the skills I'm learning. I wasn't really thinking of it as necessarily something that would be a career move. It turned out to be so much more than that, which I didn't really expect. That was something that really resonated with me and made me think, okay, well, maybe that's the direction that I'm called to work in for my career, and that's why I came to McCombs.
Even with all the different people in business school, I don't think we have people with quite the interests, obviously, that the public policy students have.
Having a Haitian background, I did a lot to help the group with some of the cultural differences and some of the language.
We all were very, very different, but at the same time, it was just a great combination of people.
Working with the McCombs students was interesting. They also were really well organized in terms of how they were going to get through with the trip, and I think that comes a lot from how they had been structured in their first year of studying.
When we'd sit down and discuss what we saw during the day, how we'd all draw different things from sitting in the same half-hour meeting with just 5 people, and we draw such different observations that we'd make.
We came up with a long laundry list of ideas. So we would do interviews and data gathering during the day, and then at night we would convene as a team and kind of sift through it and talk about what we've seen and what we've heard.
So it's our job now to come back to the States and figure out how do we put funding to those solutions via the nonprofit.
I believe there's 32 projects in all. But we really say, if you're going to spend money in Haiti, if you really want to help these people, focus on these 6. And then after that, here's here's more projects in priority order.
There was just so many phenomenal things about this trip. We saw a side of Haiti that you will never see on CNN.
I think it opened my eyes to a whole different way of thinking.
People were generally smiling and happy and cheerful and pleasant and calling out to us in a way of welcoming. We were actually surprised to see that people seem to be doing pretty well in the community.
We heard lots of sad stories because we asked for them. But if you, in general, sitting in the town square, watching the children play and watching the adults play dominoes, and you wouldn't think that this nation had been hit by so many tragedies and was still in the middle of a recovery, because they just keep on living.